Hi everyone, this presentation covers Chapter 32 on qualitative analysis in the third edition of Jacobsen's textbook, Introduction to Health Research Methods, a Practical Guide. In this chapter, you will learn that qualitative data analysis uses inductive methods to understand emergent themes and theories. Here is an outline of the chapter. Section 32.1 is an overview of qualitative analysis. Section 32.2 goes over analytic and interpretive frameworks. Section 32.3 goes over codes, categories, and themes. Section 32.4 goes over manual and electronic coding, and Section 32.5 covers quality assurance. Section 32.1 Overview. So the goal of qualitative analysis really is to understand the ways that people find meaning in their experiences and develop themes and theories that explain those phenomena. So there are different approaches to do that. So naturalistic inquiry is an approach that is frequently used, and it looks at the data that are collected, and it has an approach that is a holistic process that may involve several rounds of data collection, analysis, and interpretation in which preliminary themes and theories are identified, and then those data may inform what is collected in the next round. And so it's a cyclic process. And so this cycle might continue until data saturation has been reached and data are no longer providing new information. So for example, if you're asking people about why they need services, if they continue to say it's for educational needs, if it's continued to be mentioned that they need it for health, that they need it for preventive screenings. If people continue to say the same thing, you may decide, I'm done, I don't need to collect more data. Or that may bring up another topic and say, oh, I need to actually start to ask more information about that particular topic. So the responses really guide what the next steps are in the data collection and analysis process. And so figure 32.1 goes over some differences in the qualitative and quantitative analytic approaches. So quantitative being collecting numbers, the more numeric responses, more structured, whereas qualitative is the language and trying to understand meaning and a more even though it's a systematic process, there's more flexibility. And so the goal in a quantitative study would be to predict a result, say, versus in a qualitative study, you're looking to understand. Your data types in a quantitative study are more facts and numbers versus in a qualitative study, you're looking at opinions and narratives. The data collection approach for a quantitative study is more formal, more impersonal and detached. It's very systematic versus the qualitative study approach, which is informal, more personal and reflexive. And the data analysis approaches for a quantitative study or deductive. So they're very theory driven. They use the data to test the theory, and you have a specific hypothesis set up front versus a qualitative study, which may be more inductive. It's data driven, and you take that data to generate theories and have a more holistic approach. And so there are three main modes of reasoning that are identified is as used in research. So deduction, making logical inferences based on facts or widely accepted premises, and conclusions are assumed to be certain, and this is used more in quantitative studies. Induction, making inferences based on observations and conclusions that are likely to be assumed, and abduction, which is making inferences based on limited observations and minor premises, so conclusions are assumed to be best guesses that are merely probable. And so deductive reasoning moves from going from general theories to specific data, and so that's used in quantitative research a lot. Inductive reasoning moves from specific observations to general theories, and then quantitative research really takes that deductive approach and already has a set hypothesis versus qualitative research, which usually has a more inductive approach, and then that process is used to create hypotheses later. So there were just different approaches to try and find the same things. And so Section 32.2 goes over some different analytic and interpretive frameworks. There are many of different approaches that can be used. There is grounded theory, which is a very common approach that is used that goes it's an inductive approach, and it helps create causal theories about a phenomenon. And one of the techniques that is used for that is a constant comparison. And this is the process in which qualitative data are collected and analyzed simultaneously rather than waiting to begin analysis after all data have been collected. So typically I have a research study. I may look at the data halfway through the study, but oftentimes you may want to wait until the very end to look at the data. Whereas a constant comparison is you are analyzing and looking at the data continuously, and then your categories that may emerge from one round of the data analysis may inform the next round of your data collection. We also have content analysis, and this is a process of categorizing textual data. So the text can be from documents, speeches, photographs, videos, or other media. And you start by looking at the different coding in the text and then determine how often those occur and then what patterns may occur from there. So for example, I've been working on a study looking at Middle Eastern and North African individuals. These individuals are categorized as non-Hispanic whites in the United States. That is actually the definition of a white individual in the United States is someone from Europe, North Africa, or the Middle East. Now, there has been a lot of research showing that individuals from that area do not um, either present as white or do not feel as if they are white, and the different lived experiences that they have had may make them check, say, an other checkbox or some other race or a multiple race group. And so we've been looking at some of the comments that have been mentioned by people on a proposal by the US government to give them a separate checkbox. And so initially, when I looked at the comments, I was focused really on whether or not they mentioned needing it for health data, for money for health, for anything related to health. But what's really come and emerged from some of those themes has been related to language services. So Arabic is one of the fastest growing languages in the United States, and there really is nothing provided for them in Arabic. Another thing would be education resources, so scholarships that may be available to other minoritized populations are not available for this group. And so when looking at different comments that people have mentioned, then the themes that have emerged from that study have changed. So it's gone from just looking at health, but it's also looking at the need for language and the need for educational support. And so a narrative analysis occurs when you're really just trying to look at the different personal stories, and then you look at the content and trying to create themes from personal stories. And so this could be used in something very similar, but usually it's when people are asked to give some sort of specific story about their lived experience. Discourse analysis is the use of tools to evaluate written and spoken language, and hermeneutics is the study of the interpretation of texts, including the layers of meaning that are embedded in the text, images, and other artifacts. And so these are kind of all different approaches to the same thing of trying to create some sort of theme from the written, the spoken, or observed actions of someone's lived experience. So section 32.3 goes over codes, categories, and themes. And so since qualitative analysis is a flexible one, there are different steps and different approaches. But what's most important is that it should align with the theoretical paradigm and methodology selected for the projects. Projects applying grounded theory typically go from collecting data, transcribing interviews, then assigning initial codes, then creating categories, themes, and developing a theory. But sometimes projects have multiple cycles of data collection, analysis, and the theory creation. Other times they only have one, and so it's really flexible depending on the study. And so figure 32.2 goes over that flexibility there. So you may start with collecting data, then you prepare the data, say if it's transcribing interviews, then you create codes for the data, and then you may go back and collect more data. But then you may go on to identify categories, and then you may go back and collect more data, and then you may identify themes, and then you may go back and collect more data. And so it all just depends on the study. But most of all, it follows this flow with a few different arrow backs in it. So looking at code, so a code is similar to the data management process within a quantitative study. So coding or indexing is the use of words or short phrases to briefly summarize the content, attitudes, processes, or other aspects of items that are transcribed within a qualitative document. And so it's really meant to be a label for a word or a phrase. So it could be a label for language. It could be a phrase, language or linguistics, services, or lived experiences. And so typically what you want to do is read the full content of the data and then use words or phrases to create a category for it. And so you may have some preset codes. And so these are things that you started your data analysis with. So in my study example, I started it off with health. Why do people want a separate checkbox for health reasons? And then you had emergent codes, which were the concepts that were identified from those initial themes. So not only was it health that I was looking at, but I realized that social determinants of health were so important. And so I added some additional themes onto it as emerging themes. And then the second level of coding is categories. And so here's where you want to identify trends and patterns, look for relationships between different codes, and begin to understand multiple layers of meaning. And this could include pattern coding, which is where you seek to group codes into a limited number of categories. So you may have multiple codes related to health, and then you have one big health related code. So for example, I think a lot of people mentioned in that study maternal mortality, COVID-19, preventive health, cancer screenings. And so those are all related in different ways. You have infectious disease, chronic disease, and so you can create different ways of bringing that pattern together. And then focus coding seeks to identify the most frequent and important categories. And so this would be, maybe it's something that is mentioned most often in the comments. And then the third level is themes. And so this is thematic coding, and this is where you would synthesize different categories into a broader concept. And so that concept emphasizes one or other categories. So social determinants of health could be a broad theme that encompasses many different aspects of health together. Then you could also have axial coding used, and this is where you identify one core category or core phenomenon, and then you have several different related categories that express major and minor themes of the analysis. And so it's all related to a theme here. And then these themes can also make up a theory. And this is a systematic explanation about the different themes that are comprised of the different codes. And so it's just a higher level theme that has multiple themes there. And so section 32.4 goes over manual and electronic coding. And so the process of coding qualitative data can be very different. It can be by hand or facilitated by a computer program. It could be that you read everything line by line. It could also be that you look for certain keywords. So I've used Microsoft Excel to filter different search terms. And then the responses that don't have those terms, then I end up reading line by line. And so it assists my research in that it makes it a little bit quicker by being able to filter it out first, but then I read it line by line later. And so there's different ways of doing that. There are also different statistical software programs such as NVivo or Deduce that can do that for you. And then you also want to look for reliability. So if you have multiple people looking at the data, intercoder reliability is present when multiple coders code the data consistency, and then intracoder reliability is present when one coder applies codes consistently as well. So then section 2.5 goes over quality assurance. And so like quantitative data analysis, qualitative data analysis needs to have some sort of quality assurance. And so you want to look at the data for credibility, and this is interpreting the data accurately and that it reflects the study groups or text. So you're looking for internal validity, that it measures what it intends to measure. Transferability, so this is your generalizability, your external validity, and that is it likely to be applicable in other circumstances. The dependability, so this is indicators of consistency demonstrated through transparency about data collection, analysis, and interpretation methods. So this is all the methodology used and written out when you write up your paper. And confirmability, an indicator of neutrality that is present when results of the study are shown, not to be due to researcher bias. So if you are ever involved in a qualitative data analysis, I encourage you to work with someone who is versed in qualitative data and use them as a statistical consultant as you would for a quantitative study, but they would be able to guide you on the different ways to look at themes in the appropriate manner for qualitative analysis. So that is it on chapter 32. Thanks for listening.